Hello, my name is Elaine Price, and this lesson will focus on content and construct validity in nursing education. At the end of this lesson, we will be able to differentiate between content validity and construct validity and understand the importance of validity and reliability in nursing education assessments. As nurses and future nurse educators, we know that assessment in nursing education is foundational to determining whether students have achieved the knowledge, skills, and the attitudes necessary for professional practice. The validity of assessment tools ensures that results are meaningful, trustworthy, and appropriate for decision making. So what is validity and what does it mean? Validity, according to our textbook, refers to the meaningfulness of the interpretation that teachers make of assessment results. It also means the way we interpret and use student scores is accurate, fair, and supported by evidence and educational theory. There are two primary forms of validity: content validity and construct validity. Content validity concerns whether a test adequately covers the subject matter it is intended to assess. Did the test actually assess what was taught? It ensures that all essential elements of the instructional content are represented in the assessment. This form of validity is particularly important in nursing, where exams must be aligned with course outcomes, accreditation standards, and clinical competencies. It's often established through expert review or the use of test blueprints. A couple of examples of content validity include a skills checklist for inserting a Foley catheter would include all the procedural steps. Another example is a final exam of any course that covers all the topics and objectives of the course syllabus. Construct validity refers to the extent to which an assessment measures a theoretical concept or trait, such as clinical judgment, professionalism, or empathy. These are abstract and multifaceted qualities that can't be directly tested, but are inferred from behavior or performance. In nursing education, construct validity is crucial for assessing competencies that go beyond just rote knowledge. Some examples of construct validity include a simulation scenario that evaluates a student's ability to recognize deteriorating patient conditions and implement appropriate interventions, which would measure the construct of clinical decision making. Another example would be a reflective journal that aims to assess empathy and ethical reasoning. This next slide shows a comparison summary of content and construct validity. So take a few minutes to review the chart, or you can pause the video to make some notes. Chapters 1 and 2 of our textbook emphasize that validity and reliability are really inseparable concepts in effective assessment design. Validity is based on the interpretation of the results, not a property of the test itself, and reliability is critical for consistency and fairness. Validity and reliability are both essential for making ethical and accurate decisions. In conclusion, examining content and construct validity shows that they both play a unique but supportive roles in creating effective assessments in nursing education. Content validity refers to whether the test or assessment accurately covers what it was intended to cover. Construct validity measures a theoretical concept, and validity and reliability ensure meaningful and ethical assessments. As future educators, we must continue to evaluate and update our assessment tools. And here is my reference page.